Okay, so that's 2 o'clock, and we will try to keep as best we can to time. I know that is difficult sometimes, but we'll try and just keep whistling along. So welcome to the Care Inspectorate's webinar on meaningful connection, and we are the Meaningful Connection Visiting and Law project team. I'm Barbara Lawson, and this is my colleague Sherry Kerr, and we're delighted to be supported by Louise Kelly. She may be a familiar face to many, but she's the kind of lead for the CAPA project, which I'm sure many of you will know about. So thanks, Louise, for joining us today. So just a bit of housekeeping. For those of you who have not been on one of our webinars before and you would like to be involved in the interactive parts of this, please use your smartphone and you go onto your camera and you just hold your camera up, hover over the QR code, and it should take you to a link, and then you'll be able to see the slides coming up on your phone. I'm never quite sure because of the blur background what people can see. And that allows you to interact, add your comments, and we've got some interactive case studies which we're looking forward to. We've enjoyed putting the content of this together. It's very thought provoking, and we found it helpful just, delving a bit deeper into that human rights based approach. So we'll also be looking at the health and social care standards and how we can apply these to various settings. So we would like to welcome you all again to the webinar, and a recording of this will be made available on the website, and it will be emailed out in due course, as will the slides. And we will also be producing some fact sheets for all of our webinars, so look out for them. Okay, so let's move on to the presentation. So what we'll be covering today, so human rights and meaningful connection. So how do human rights, how is that really just woven through all aspects of meaningful connection? And what does this mean for people in care homes? And don't worry if you're not from a care home background, there is so much that is transferable to all care settings. So, you're welcome, and, please signpost people to the recording if you think it'll be helpful. Also, we'll be looking at the health and social care standards in a bit more detail. And as I mentioned earlier, there'll be some interactive case studies. We acknowledge that this is a big subject and we can't cover everything, and I'm sure that there's many people on the call that will be, very knowledgeable about this. So we want to plug into that knowledge during the webinar. So we will be, it's mainly an overview and a focus on specific principles and standards, but please, when the interactive sections are there and there's an opportunity for you to share your knowledge and your experience, please do. And I know the feedback that we've had from previous webinars is that people really benefit from learning from each other. So that's great to have you all with us today. Okay, so a kind of standard slide in all of our presentations is about the Visiting Meaningful Connection and Anne's Law project. So a bit of background is that the project was set up to support and promote the importance of all types of meaningful connection for people who live in care homes, and as well as helping prepare the sector for the implementation of Anne's Law, it's really to really focus in on why meaningful connection is important. And as I said, it's transferable really where anyone spends time with other people. So for people who want to know a bit more about Anne's Law and the current situation, we've put together a basic fact sheet, which we'll put the link into the chat. And in brief, it's a planned legislation which resulted from campaigning by relatives who were separated from their loved ones for long periods during the pandemic. And we can't underestimate how difficult and traumatic this was for people and the impact that it had on people's well-being. But I think you'll find that the fact sheet is helpful, and please feel free to share that with your colleagues. Anne's Law will strengthen people's rights to have contact with those who are important to them, even during an infectious disease outbreak. While it's not yet in legislation, we have 2 new health and social care standards which were introduced in March 22, which support people to stay connected even if there's restrictions needed at any time. And we'll look at these standards in a bit more depth later on in the webinar. And during the pandemic, from a kind of human rights perspective, there was a real difficulty in balancing people's rights due to the changing context and the threat to life. This was often unbalanced against people's right to a private and family life. Okay, so we're going to move on to the first interactive slide. So when you think, what comes to mind when you think of human rights? And using the word cloud, just type in a word or 2 words. If you try and keep it short, you can add multiple entries. So when you think of human rights, what comes to mind? And a word cloud will appear. Freedom of speech, yep. And Louise is going to come in here and help to bring out some of the key themes. So over to you, Louise.
Yes, definitely lots about freedom of speech and of choice. And big one in the middle there is choice, decision making, and this idea of equality, that it doesn't matter who you are, where you are, perhaps, or what age or stage of life, that you have an equal human rights to other people. Yeah, definitely some things about equality. I've got to turn sideways and everything. Privacy, treated equally, risk taking, which is an interesting one. And it's essential. And it's absolutely right to get the basics right. So big ones about choice, equality, freedom, decision making, things being fair, I would say, at this stage.
Yep. Definitely. So that's really, really good content there. So thanks everyone for your contributions. And we're now going to pass over to Sherry, who's going to introduce us to some human rights.
Yeah. Hi everyone, and thanks for coming along. Hopefully, I know some people had difficulties hearing, so hopefully most people can hear me okay. So what we're going to do now is just to give a very brief overview of what do we mean by human rights and a human rights-based approach, and how does this relate to care homes in particular. So human rights obviously are the basic rights and freedoms which belong to everybody. They're based around respect for the fundamental dignity, equality and autonomy of all people, which principles are, of course, also at the heart of providing good care, and they underpin the health and social care standards, which we will talk about a bit more later on. Human rights apply to everyone equally, provide protection for the most vulnerable in our communities, which obviously does include many people who live in care homes. They include civil and political rights, such as the right to vote and the right to freedom of speech, social and economic rights, such as the right to health, education, and respect for private and family life. Can never be taken away, but they can, in some circumstances, be restricted. So people who live in care homes are often, as I said, among the most vulnerable in society, and they can face the biggest obstacles to realising their rights. People who live with dementia, learning disabilities, sensory impairments, physical and mental ill health and frailty, for instance, can face particular difficulties. At the same time, we know that people who work in care homes often go to great lengths to overcome these obstacles and to support and uphold people's human rights. So taking that human rights-based approach to providing care services just helps ensure that we're really keeping these principles at the core of what we do and providing better outcomes for people. As a lot of people said on the slide there, I think it's about putting the person at the centre, empowering people to know and claim their rights, ensuring that people and institutions who are responsible for protecting rights, who are known as the duty bearers, are accountable. So just about making sure that human rights standards and principles are really embedded in policy making, as well as in people's day-to-day care and supports. So what we're planning to do during this webinar, because we've only got an hour, is to focus on some key rights that are relevant and to talk about the principles and tools which can be used in taking a human rights-based approach. Okay, so just a very quick legal background. The European Convention on Human Rights protects the human rights of people in countries that belong to the Council of Europe, which does include the UK. The Human Rights Act 1998 brought the rights in the European Convention into domestic law, and that's the main legislation that protects our rights in Scotland. It sets out the rights and freedoms that everyone in the UK is entitled to in a series of articles, and it ensures that new laws should be compatible with these. Currently, there is consultation ongoing on a new human rights bill for Scotland. We'll put a link in the chat for anyone who's interested in being involved in that. But at present, the relevant legislation is still the UK-wide Human Rights Act 1998. So some other relevant bits of material, there's the UN Principles for Older Persons, which considers independence, participation, care, self-fulfillment and dignity, and appreciates the contribution that older people make to society. There's also the UN Convention on the Rights of Persons with Disabilities, and the core of that is to value and empower every person who lives with a disability so that they have the same rights as everyone else, and it really emphasises empowering people to participate fully in society. There are some rights which are absolutes, such as the right to life and to freedom from inhuman or degrading treatments, and there are some which can be limited in particular circumstances, although any restrictions have to be lawful, necessary, proportionate, and non-discriminatory. So what we're going to do next is just look briefly at a couple of rights which are particularly relevant to people in care homes, although of course all the same rights that apply to everybody also apply to people in care homes. So when we're talking about meaningful connection, I suppose one of the most important pieces of human rights legislation is Article 8 of the Human Rights Act, which people will be familiar with, I'm sure, which covers many aspects which are very relevant to people in care homes. Article 8 is about the right to private and family life, which is interpreted very broadly, and I'll just quickly run through some of the main things that it covers, as you can see on the slide there. So privacy, for instance, that could include the right to your own private space, the expectation that people will knock before entering your room, the right to meet people in private. It also means that personal information about you should be kept securely and not be shared with others without your permission. Family life, that's very broad, and that covers being able to maintain close personal ties with the people who are important to you, which doesn't have to be blood relatives or officially recognised. So obviously that's particularly relevant in relation to meaningful connection. Physical, psychological and moral well-being is about the right to well-being through having autonomy, dignity and choice. And again, this covers many things, but for instance, it could relate to being able to engage in meaningful activities or being involved in decisions about care and treatments. A home is the fourth one. That doesn't refer to the right to housing, but to respect for the home life of an individual, which also includes living in a care home, which obviously are people's homes. So this could include, for example, welcoming and entertaining visitors, which you'd expect to be able to do in your own home. And finally, correspondence. This covers all kinds of communication with others, such as phone calls, video calls, letters, emails, and so on. People have the right to correspond privately with others, and they should be supported to do so when that's what they want. So Article 8 is a qualified right, which can be restricted in certain circumstances. And that means that a public authority, such as the government, can sometimes interfere with the right to private and family life if there's a legitimate aim. So that could be if there's considered to be a pressing social need, such as public health reasons. However, the interference must be the minimum that's needed to achieve the legitimate aim. Article 5, I love that picture, is also relevant. This is about the right to liberty and security, and it protects people against unjustified deprivations of liberty. So again, this often needs to be considered in care homes when there are restrictions on people's movements, such as locked doors, bed guards, fall sensors, and so on. Could also include, for instance, not having access to a walking aid, which restricts people's freedom to move about. Basically applies to any restriction on people's freedom of movements, which could include physical or chemical forms of restraints. Again, the right to liberty and security is a qualified right, so it can be restricted. But again, any restrictions must be justified, lawful, and the minimum necessary, which is where your risk assessment comes in to evidence that people's rights are being protected and any restrictions are being kept to a minimum and they're regularly reviewed. Obviously, complex situations can sometimes arise around this, and these should be discussed collaboratively with the wider professional group if needed, involving all the relevant parties. Many people will be familiar with the Mental Welfare Commission guidance on rights, risks and limits to freedom, and we'll put a link to that in the chats. Okay, so just for fun, a quick poll with some facts and figures, and you can use your phones to vote. I'll hand you over to Louise for that.
Right, so we hope that you're using your phones, and if you haven't, you can see the information in the chat about how to do that. You can put your you can scan the QR code, and I'm just waiting while people join in. And if you do on your phone, you'll see you can make your best guess as to how many people aged 18 and over. So at the moment we're neck and neck between people reckoning it might be 33 and a third thousand or 42 and a bit thousand, neck and neck there. Not so many people thinking there are, you know, close on 29,500. So, and what's just crept up is the one in the middle, middle number, 33,352,000 people aged 18 and over living in a care home in Scotland. That's so 40, there's lots of numbers on this. Yeah, 43% chose that. Yep. Oh, 44.
And it's changing, but yep. So 33,352 is the correct answer. And we'll move on to the next poll.
Okay, you know how this works now. So which percentage of people considered themselves as disabled in 2015, 2016? And you've a choice there, about 19% of people, 22% or 26%, and 26 is winning at the moment there. Most people think it's that one.
We'll give it a few seconds more and then we'll move on. Okay, so the correct answer is actually 22%. Yeah. So moving on to the next poll before we move into some information about the health and social care standards.
Right, 2 out of 10 people. Wow. Okay, and this is about the numbers of people, you know, how many people, what percentage of the population were over 65 back in 2019. And people reckon it's going to be the larger percentage, that 27% of people in Scotland were over 65. So almost a third at that stage. Yeah, I think everybody's going for that one, Barbara.
Okay, well, the correct answer is actually 19%. However, the projected, you know, I think by it was like 2043, I think it goes right up to about 35%, the projected. So at the moment, in 2019, it was 19%. And the reason we've got these polls in is just to show how relevant the disability, the care home, and older people, so all of thinking about the human rights and the UN conventions that are there, you know, how relevant this is to people living in Scotland. Okay, so thank you, Louise. And we'll move on to the next slide. So a lot of this information will be familiar to many of you, but we thought it would be good just to recap about the health and social care standards. So before we look at the principles of a human rights-based approach, we will briefly introduce the standards. So they set out what we should expect when using health, social care and social work services across Scotland, and they seek to provide better outcomes for everyone to ensure that individuals are treated with dignity and respect and that basic human rights are upheld. They replaced the national care standards, and from 2018, back in April 2018, they were taken into account by the Care Inspectorate and other regulatory bodies. The standards are a collective term to describe both the set out headline outcomes, which are shown on the slide, and then each one has a descriptive statement which sets out the standard of care that people can expect. And that is broken down into a number. So it could be like 1.1 and it goes right up to 1. I can't even remember the number, but 33, 45, so 2.10. So when you hear us referring to these numbers, the first number refers to the headline outcome, and the second number is to that specific descriptive statement. So just looking at them briefly, I experience high quality care and support that is right for me. I'm fully involved in all decisions about my care and support. I have confidence in the people who support and care for me. I have confidence in the organisation providing my care and support. And I experience a high quality environment if the organisation provides a premises. So these are underpinned by 5 overarching principles, which you can see on the screen. And these are set, principle statements are then aligned to each of these. So we've got your dignity and respect, compassion, be included, responsive care and support, and well-being. So just thinking back to that Article 8 and Article 5, you can see how they closely link to the principles of the standards. So we'll look in more detail at some of the standards throughout this presentation, and although some refer specifically to human rights, such as 1.2, which says my human rights are protected and promoted and I experience no discrimination. There's many other standards that don't specifically refer to them, but they're underpinned by human rights values throughout. And we saw some people joining from Out With Scotland, from which you're very welcome. So for those who are not familiar with the health and social care standards, we will again pop the link in the chat and you're able to access them there. So we're going to pass back over to Sherry to start looking at in a bit more detail about the human rights-based approach.
Thanks, Barbara. Just hopefully got my camera and my mic back on again there. So, yeah, thinking about the principles which underlie the human rights-based approach, these are known as the panel principles, and that stands, as you can see on the slide, for participation, accountability, non-discrimination, empowerment and legality. So we want to think about what these principles mean in practice and how do they apply to all of us, but particularly to people in care homes. And we'll discuss that over the next few slides. There's going to be a fair bit of talking from me, I'm afraid, but we're going to follow that by looking at a short case scenario, so people will get the chance to contribute to that. Okay, so the first one of the panel principles is participation, which means that everyone should be able to be involved in decisions that affect their rights. This is reflected in the Health and Social Care Standards core principle of being included, which underpins all the standards. And regarding care homes, this asks the question, are services enabling people to participate actively and meaningfully in decisions about their care and supports and about policies and practices in the care home as a whole that affects them? So this includes their wishes and preferences for meaningful connection, social contacts and relationships. And of course, during the pandemic, people in care homes did face the most and the longest lasting restrictions, but their voices and opinions were rarely heard in terms of decision making. So it's about how do we make sure that everybody's voice is not only heard, but is at the heart of planning. And for many people in care homes, this can be difficult, particularly people with dementia or learning disabilities, for example. So it's necessary to consider what the barriers are and how they can be addressed, such as by using advocacy services or specific communication tools, for instance. Okay, the second panel principle, accountability, is about making sure that people and organisations who provide services, that's the duty bearers, are accountable for ensuring human rights are upheld and that people have a recourse if things go wrong. And in order for this to be effective, there have to be appropriate, accessible and easy to use systems in place for people to raise concerns and to have them addressed. So thinking about what avenues do people have to raise concerns, how are they dealt with, how are people informed about them, do people feel comfortable and empowered to raise concerns, ensuring that people have clear, easy to understand information about how to raise any concerns and they can be confident they'll be dealt with without any negative consequences. And that links to the health and social care standards about complaints handling, which I think is 4.20 and 4.21. One thing that we often hear is that people are reluctant to raise any concerns that they might have because they don't want to rock the boat or because they're worried it might damage relationships. So if people still aren't satisfied after making a complaint, what avenues do they have to escalate it? Making sure that people know what they can do and the procedures that they can follow. And we did look at this in a bit more detail in one of our previous webinars about family carers as partners in care. And you can still access those recordings on the Care Inspectorate website on the Meaningful Connection tab if you're interested. Okay, so the third panel principle is non-discrimination and equality. And a human rights-based approach means that all forms of discrimination should be prohibited and prevented, including age, disability, gender, race, and so on. This also means that where people are most marginalised and where they face the biggest barriers to realising their rights, that they should be prioritised. So I guess it's not necessarily about treating everybody the same, but about trying to make sure that they have the same opportunities, which might often mean paying particular attention and providing a lot of extra support when people are the most vulnerable and face the biggest obstacles, such as if people are living with dementia, sensory impairment, or a learning disability, or indeed all three. Just making sure that everybody has equal opportunities to realise their rights and can get the support they need with things like, for instance, accessing the community, practicing their own religion, or having additional support to communicate if that's what they need. And this relates to Article 14 of the Human Rights Act, which is the right not to be discriminated against, and of course also runs through the health and social care standards, with one of the core principles being that I am treated fairly and don't experience discrimination. And the Equality Act 2010 is also relevant here, as it prohibits discrimination on the grounds of specific protected characteristics, which include disability and age, as well as things like race, sex, and so on. Okay, so thanks. The fourth principle is empowerment. And that's about making sure that people know about and understand their rights and how to claim them and have access to the services they need to get the best out of life. That are people and their families given the tools that they need to do so. So it's about making sure that people know that participation, equality and so on are not an optional extra that's maybe nice to have, but are their legal rights. And again, there's a duty to provide extra support when needed. So could mean providing written information in a format that people can understand, or explaining verbally to people in ways that are meaningful to them. Making sure that someone with dementia, for instance, knows that they have a right to be involved in decisions about their care in ways that are suitable for them and that their voice is important. The Charter of Rights for people with dementia and their carers is based on the panel principles, and I think Louise has just put a link to that in the charts, and it also underpins the dementia care standards. Okay, so finally, the L in panel is for legality, and this means that people experiencing care should be able to be confident that services are acting in accordance with the law and that all their human rights are being respected and promoted and are embedded in policies and procedures. If people don't have the capacity to make specific decisions themselves, anyone acting on their behalf must make sure that they're doing so in accordance with the principles of the Adults with Incapacity Acts. Okay, so that's enough talking from me. And I think on the next slide, we've got a short case study to think about how the panel principles might be relevant in practice. And Barbara and Louise are going to take you through that. Thank you.
Okay, thank you, Sherry. Lots of really, really important things and certainly food for thought. So the interactive case study, so we'll read it through. We've got it up on the screen and you should be able to refer back to it on your handset if you're using your phone. So several residents at Fairbank Care Home, not a real service, like to spend time sitting in comfy chairs in the reception area. They could see people coming and going and chat to each other. It was an important social part of their day. The management had concerns about safety hazards due to walking aids taking up space in the area and decided to remove all the chairs without consulting or discussing it with the residents. The residents were upset that they could no longer sit there, and this had an impact on their enjoyment of day-to-day life. Okay, so using your the QR code and the interactive section, just very briefly, you could do short answers and to multiple ones if you want. So thinking about the panel principles, the participation, the accountability, non-discrimination, empowerment and legality, which ones do you think are relevant here, and briefly say why? And Louise is going to come in and highlight your answers. I can see participants are typing, so that's always encouraging. Over to you, Louise.
Right, I'll just give people a bit of time to pop in their ideas because plenty to think about here, many principles to apply. Right, they're coming in hard and fast here.
Great.
And definitely that principle of participation, which was, we know, is about being involved, being heard, and everybody's voice is important. That's certainly one that people are saying, oh, hang on a second, that was, that principle was being denied or overturned or whatever. So straight away about that lack of consultation. And let's see, what else is there? Empowerment, that people know and understand their rights and they know how to sort of claim their rights. So everybody's up in a heap at the care home and they feel they've been, pushed aside and decisions taken, but they're not given a voice about the actual thing happening or maybe afterwards. Somebody saying, well, all, because they all have an impact on the person.
Yeah.
And there's something there about accountability also. Are people aware? Do they feel comfortable to raise a concern? How do they know how to raise a concern? So we don't hear what happened afterwards, but definitely some aspects there. So I don't know whether you could click on to page 2, because we can see page 1 of 2. Yep. And I think there are more.
There we are. Oh yeah,
lots
of good ones here. Wow.
More. Discrimination. People without walkers. Could risk assessment not have been done? So people are absolutely applying, oh my goodness, I would have done it differently. No consultation, no opportunity to look at any risk and reduce risk in a different way. And were they given a chance to make a complaint? And that lovely one about risk versus reality. And with risk assessments, oftentimes people really focus in on the risk of something happening rather than the risk of the change happening. And decision made without consultation. So it really covers all of the different areas there very well, I think.
Yep, and in the chat we've got some comments as well. So a few people saying all, no attempt to remedy, no inclusion, no communication, no right to life, no liberty and security, staff understanding of human rights. So yeah, just that opportunity. So lots of good things there. coming in. So thank you. And yeah, the choice, institutionalized. Yeah, so lots of things there. And some of the key health and social care standards to link in. Here's that be included, you know, and I am included in wider decisions about the way the service is provided, and my suggestions, feedback and concerns are considered. And also for empowerment 2.11, my views will always be sought and my choice is respected, including where I have reduced capacity to fully make my own decisions. So you can see how the health and social care standards really link into this. So thank you everyone so much for your contributions. And we're now going to move back on to Sherry to give us a quick overview of the FAIR framework. So Sherry, over to you.
Yeah, thanks, Barbara. Sorry, just turning my mic back on. Couldn't find it there for a minute. Yeah, so we're next going to look at a tool which can be used to make human rights-based decisions, which could potentially, but obviously wasn't used in that case study. So human rights principles can give a really strong starting point for decision making, and complex or thorny situations can often arise in care settings which people don't necessarily immediately know how to address. And going back to those fundamental principles is a good way to think about whether you're on the right lines. So one tool which can be used is called the FAIR approach. And this has been developed by the Scottish Human Rights Commission to help with decision making using a human rights-based approach. And using the FAIR approach involves considering what are the relevant facts to understand, what is the experience of the people involved, are they being heard or do they need help to make their views known? Analyse what human rights are at stake in this situation. Are the rights absolute, such as the right to life, or able to be restricted, such as the right to private and family life? If they can be restricted, what is justification for this? Is it the minimum necessary restriction? Identify what needs to be done and who's responsible for doing it. And finally, decide upon actions and later review and evaluate what has happened as a result. Has the person or the people affected been involved in the decision? And we've got another short case study, which hopefully helps to illustrate that using the FAIR approach in practice. And back over to you, Barbara.
Okay, thank you. So the FAIR approach, so the facts, analyse, identify and review. So have a wee think about that as I'm reading this out. And again, the next slide will be bringing you in to bring in your thoughts and your comments. So Lillian is an 89-year-old lady who experienced a stroke which affected her speech, and she has a significant right-sided weakness. She needs support to transfer to the wheelchair with a hoist and 2 staff. Her head needs support and she has her own specially made wheelchair. Her husband Bill visits the care home every afternoon and they like to spend time together in her room after Lillian has been supported with personal care and is resting on top of her bed. Bill will sit with her and they usually FaceTime their daughter in England who is terminally ill. Recently, when Bill has been arriving at the home, Lillian is often still sitting in the lounge and her wheelchair can't be found. Bill has approached staff about this and it continues to happen. Today, Bill arrives at the home and finds the situation has happened again, and once again, they haven't been able to spend time in Lillian's room and call their daughter. There are no staff available to assist as they are all on their breaks or busy elsewhere. Okay, so interactive case study, the facts of the situation, analyse the rights at stake, identify responsibilities, review and evaluate the actions. And we've popped up just the kind of key points of Article 8 and Article 5 for your consideration. So again, we can see people typing away. It's always encouraging when you see the 3 dots moving up and down. And I don't know, Louise, if you're around to help with this one.
Yeah, absolutely.
Great. It feels quite emotional actually reading that out, you know,
Yeah,
just
it certainly
with
does.
so
Yeah.
many things, you can just really feel that.
And there's some information in the chat as well, that there's things that are neglected are inclusion, communication, right to life, liberty, security. And there doesn't seem to be an attempt to remedy the situation because it's been going on for some time. And the staff understanding of human rights legislation is poor. And this impacts, there should be an impact assessment on their rights. All involved, well-being has been affected. The right to privacy and family life is just non-existent, and restrictions on their movement. Somebody reckons an extreme violation of rights. So, and in our on the main screen, there's so many different aspects of here about rights to privacy, freedom of movement, needs aren't being met, privacy, and that it's very concerning about moving of personal piece of equipment. It just isn't acceptable. So as you say, it's very, very emotional in terms of it's neglecting the rights of the resident and also of the husband, and that basic rights to human contact. And slipping between the cracks within this particular care home is a really important thing that matters immensely to the woman and her husband, and indeed her daughter. So plenty of concern and worry here.
Yep, so lots of key points here. So thank you very much. And also something that's just come to mind, that she was due to have her kind of personal care before that. So is, what's her continence needs, what's her skin integrity if she's not able to move her position. So again, if a pressure sore or wound developed, again, yep, you can see all these key points coming down. That just kind of came to mind. But also the terminally ill daughter, could that be the last possible time they speak together? And that's the impact that, some of these things have. So again, lots to think about. So thank you so much, everybody. And thank you, Louise. So moving on to the next part, and on the slide you will see four we just picked few. We could have actually picked so many to discuss, but what we want to do here is just highlight how human rights underpin the health and social care standards. And in the next slide, we will be looking at some practice examples. So using a kind of self-evaluation approach, have a wee think about what things are like in your place of work or your circumstances. Think about what's working well and how could you demonstrate this in practice. So let's look at these standards in a bit more detail and how they might be demonstrated in practice. So thinking about Article 5 in relation to liberty and security as well. So 1.3, if my independence, control and choice are restricted, this complies with relevant legislation and any restrictions are justified, kept to a minimum and carried out sensitively. And often I find with the kind of human rights based approach and linking it to the health and social care standards, there comes sometimes that what I would call light bulb moment. And it can be sometimes, if you understand the why behind we do something, it really can help staff change their practice. And I see that just to interject there, that Louise has just popped in an evaluation form in the chat, and it would be really helpful to get your feedback on the webinar, and it also helps to inform our future sessions. So thank you for doing that, Louise. Okay, so 1.3, I'm just thinking about what policies and procedures are in place. Have they been updated? Have they been communicated to people experiencing care and their families? Are staff confident in using the policies and when this applies? Is there a register of restraint, for example? How often are bed rails checked? Are AWI certificates kept in date? How is this then reflected into people's personal plans, their 6 monthly reviews? And is there evidence of participation and discussion with relevant people? Are maintenance checks up to date? How do people access the premises? How people access how can they access the outside space? Are they able to keep their belongings safe and secure? Can they lock their door? So again, you can see how 1.3 can be applied to so many different situations and helps to inform the type of things during an inspection and during your own day-to-day work, you know, in a care home. These are the types of things that you would be considering. So 1.10, I am supported to fully participate as a citizen in my local community in the way that I want. So again, how are we evidencing voting rights, proxy rights and postal votes? How does this affect when there's lack of capacity? Do people want to get out and vote if they're able? Do they have that choice? Do people have opportunities to be involved in groups in the community or attend places of worship or voluntary organisations that they might have been a part of for years and attend local events? 1.11, I can be with my peers, including other people who use the service, unless this is unsafe, and I have been involved in reaching the decision. So what opportunities are there for peer relationships? We just will highlight at this point, there is another webinar that we've done on peer relationships and supporting these in a care home, and it can be applied to any setting where people spend time together. And again, that can be signposted to you on the website. So are people who need extra support facilitated to form and maintain their relationships? And 4.1, which specifically mentions human rights. My human rights are central to the organisations that support and care for me. So again, policies and procedures, the values that are being demonstrated and encouraged within the staff team. Are staff given the opportunity to develop skills and knowledge that will empower them to support people and understand people's rights? So this is the type of thing that you can do as a discussion at a staff meeting, a resident or relative meeting, and put into practice, and you can work together to empower people, which will help you consider the impact on people's lived experience and their outcomes to ultimately support their health and well-being. And a human rights approach is not just theoretical, but it's integral to everyday life and everyday decisions. And when done well, demonstrates a values-based organisation. So earlier in the presentation, we mentioned the two new health and social care standards. So we've got 5.16 and 5.17. So I'll look at 5.17 first, but just a bit of background. So as the National Care Service Bill has been delayed, this means that Anne's Law itself can't progress. However, as an important interim step into the delivery of Anne's Law, we have these two new standards. And although there's many standards, as you will see throughout looking at the standards that focus on supporting connection with people's loved ones, these two strengthen this. And again, it was widely supported through consultation. So 5.17, so this is about being involved as, I suppose, a partner in care and just being directly involved in providing day-to-day care and support. And you can see there that there could be a daughter or a granddaughter brushing someone's hair. So it could be supporting with a meal, it could be providing personal care if that's something that people want to do. So how are we supporting people to do that? And 5.16 is really all of that I've just included, but it also focuses on during a time of an outbreak of infection, so that you can nominate a relative or a friend or a substitute to visit in the care home, whether there's restrictions to the routine visiting, but they can also be nominated during that time to be involved in the day-to-day care. And we can all think back of situations during the pandemic where, you know, people, their nutritional input was reduced because family members were no longer able to support them. And some people with dementia became such a familiar time that they would only maybe take food and nutrition and fluids from people that they recognised. So these two health and social care standards really strengthen that position. So we're nearly finished. The last one is, again, it's more hints and tips about applying these in your services, and the Growing a Good Life team, which Louise is involved. They ran a webinar on dementia care, and again there was a small section on how this can be applied in practice and some of the things that can be used to evidence that you really are embracing that human rights approach. So again, the health and social care standards could be used as discussion points, as we demonstrated in the earlier slide. Also considering self-evaluation. We've just published a Meaningful Connection self-evaluation tool, which will really help you to create a culture of connection. You could use a small section of that as part of a team meeting or as a discussion, and again, get everybody involved in that. So involving people at every point and doing this meaningfully and purposefully. Thinking about your improvement plan and how this can evidence what you want to achieve, how you are doing it, and having a robust, effective improvement plan that involves people is central to a well-performing service. And again, the Care Inspectorate website has got lots of helpful tools, which again we will add into the chat. And also considering, review of kind of legislative requirements. So are we giving people opportunities within the necessary legal frameworks? So I'm thinking about adults with incapacity, risk assessments, involving people in decision making, and some services might what they call keep a risk register, and it's a way that you can help keep track of that. So there's lots of different creative ways that you can do to track all that important information. And also, are we ensuring then that the personal plans are updated and that there's a formal review at a minimum of 6 months, or if there's a significant change, and evidencing how we're working collaboratively with the wider professionals, and are we considering maybe using advocacy services, and do people and their families know what opportunities are available? So having good oversight of systems and processes, how these are planned, tracked, evaluated, and how they transfer into people's outcomes really helps to ensure that people get the most out of life with the minimum restrictions in place. So thinking about the PDSA cycle for improvement, the Plan, Do, Study Act, which is central to any improvement journey, you might want to consider choosing a couple of the health and social care standards and do a small project involving people, as many people as possible, about what's working well and how you can build on it. Sometimes it's just looking to spark that light bulb moment, as I said earlier, about why we do things. And one of the key things for me is why we knock on people's door, and introduce ourselves. Why do we encourage people to spend time with others? Why do we let people open their own mail if that's what they're able to do? As we said earlier, a human rights-based approach is an everyday thing. The why we do things and is the essence of true person-centered and relationship-centered care. So we're going to move on to the last interactive slide, and I'm going to pass over to Sherry to finish it off.
Okay, thanks, Barbara. I think I just turned my mic off and then on again. So yeah, just back over to you before we finish. Anything that particularly struck a chord today, or maybe something that you didn't know before, or your take-home message? Anything that particularly stood out for you? And just use the phone to type in there. And I think Louise is going to come in and pick up on any comments.
There's a good one to start, that great care always promotes our human rights. It's not something extra or special, or as Barbara was saying there, that absolutely promoting human rights and the care standards and so on, they're all there as sort of protections. And a couple of people have liked the panel principles and the importance of seeing people as individuals, and that importance about privacy. Yeah, and that idea that of course it's somebody's home, and just keep reminding ourselves of that, because it's an important one to keep in mind. And again, the panel approach, people seem to appreciate that.
One that's just come into the chat there is that someone who's a power of attorney for both parents in a care home has never been informed of the health and social care standards. So we might do a wee plug on the standards across social media with our comms team as feedback from this. So thank you for putting that in.
Yeah, and it is an interesting one, because as somebody who, as you've mentioned, you hadn't heard of the health and social care standards, that's one of the reasons that it's good to leave them about, or have them available at reception or so on, because again, it's just promoting this idea that we all work to these standards. So somebody commenting there about the link between human rights and the standards, and of course how human rights should cover all aspects of somebody's care. And some questions as well. And just kind of going back, Sherry and Barbara, I had picked up some comments and queries in the chat saying that calling it Anne's Law can be confusing, because it's difficult to understand, well, what's Anne's Law if you didn't know what it was. That the UN Convention of Rights of the Child could well apply here for people below the age of 18, because there's some younger people who will be living in care homes. And couple of comments about funding and its impact on care homes, including the ability of people to leave the four walls. Something around the risk that a person deems acceptable, and how that might be quite different from what a staff member deems acceptable, and that whole tricky area. And if somebody else noted that communication needs are key about understanding what somebody is telling us, even if they're not using words. And so lots of really interesting comments about, what does this mean in reality? What does it mean when you're putting things in place? And somebody also said that peer relationships are obviously really important, but the family may not want those peer relationships to be encouraged, and in fact may want them to be discouraged, and that whole tension there. So lots of,
Yeah, so the Anne's Law, just as a wee reminder, there is a fact sheet for Anne's Law if people are needing a bit of information. And the reason this is we're focusing on it's adults and older people that this project is specifically for. But yes, there's lots of transferable things into all settings. But the focus of our project is for adults and older people, the care homes, and Anne's Law will apply to that. But these are brilliant. Okay, I'll move over to the last slide, and Sherry is going to finish off.
Okay, thanks, Barbara. Yeah, so that's it from us. We know that everyone has lots of demands on their time, so thank you very much to everyone for taking the time to attend today. We hope you found it useful. If you can fill in the evaluation form, which is in the chat, that would be great. And I know some people already have filled that in, so thank you very much. There's some stuff up on the screen there, a link to our pages on the website, which has some other resources. One final thing to mention is that while we've been doing this project, we've heard loads of really brilliant examples from people of good practice in relation to meaningful connection. And people have told us how much they like hearing about and getting inspiration from what other people are doing. So we want to devote our next webinar, which will be on the 30th of August, to celebrating good practice. So if you've got a specific example which you'd be willing to share, either by coming onto the webinar to speak about it for a few minutes, or maybe recording a short video or an audio, please get in touch with us via our email address, which is on the screen. So thanks again, everyone, and enjoy the rest of your day. Thank you, Barbara and Louise.
Yep, thank you. And someone's just asking if the fact sheet can be posted out. Unfortunately not, but it can be printed off or viewed on the website. So unfortunately, we're not able to post them out, but you could sign up to our Anne's Law email address and we will send a link out that way. So I'm sorry if you're not able to access, or maybe you've got a friend or a family member who might want to sign up. But again, check out the Care Inspectorate website, our dedicated space, and you'll find all the information there. So thank you all so much, and we'll end the presentation now.